Hello, and welcome to CommonHealth, where we have conversations that explore how Virginians think about and engage with their health and the health of their communities. I am your host, Phillip. Today we have a very exciting guest today, and that is Dr. Cameron Webb, who is Virginia's State Health Commissioner and a physician, attorney, and a public health leader whose work has spanned medicine, law, health equity, and public service. Before assuming this role, he served in national and state-facing leadership positions, including as a White House senior policy advisor, and has built a career focused on improving access, strengthening communities, and advancing better health outcomes. Dr. Webb, thank you for joining us.
Thanks so much for having me today.
Absolutely. Looking forward to the conversation. So you're a very diverse set of experiences. And so when you look across your work in medicine, law, policy, and public service, what core purpose ties all those together for you?
Well, I think kind of everybody has to have a bit of a true north. It's something that really animates them and drives them in mind. It's really centered around justice and equity. I think that's been the thread throughout my career, is finding opportunities to try to make sure that everybody has the chances to find success in life and in health. And so I think that's kind of been my true north and my thread. But I think that along the way, it's led me to so many different diverse experiences. I think that's kind of that's the special sauce, right? With every experience, I gain perspective that makes me even sharper in my work.
That's awesome. And going into some of those early memories, so those early days when you were maybe still trying to figure out what it is that you wanted to do, maybe what is one of those that really helped shape the direction that you ended up taking, if you were to look back?
Yeah, I mean, I think back to college. I went to college at the University of Virginia, and my very first class that I took in college was called Culture, Healing, and Health. And it was a great class, learned a lot about all those different factors that shape health outcomes beyond just what happens in hospitals and clinics. And one of the guest speakers in that class was a family medicine doctor named Dr. Norman Oliver. And what's interesting is that he became a mentor and then a close friend, and then eventually state health commissioner here in Virginia a couple of years ago. And along the way has just always been somebody who I really looked to for insight, for guidance, for perspective, and who helped me kind of forge my own path, which was certainly different from his. But I think that was one of those early experiences, especially early in my academic career, post high school, to give me a sense of what's possible when you want to combine advocacy with health work.
Yeah, and you brought up a great point that I definitely want to touch today, which is mentorship. And you just mentioned one of your strong mentors there. What does mentorship now look like in the other direction with maybe people who are coming behind you?
Yeah, I always say lift as you climb, right? Like as you're moving along, you have a tremendous opportunity to help sharpen people. There's a movie coming out this summer, The Odyssey, and it's a story of talking about Greek mythology. It's one of the Homeric epics, right? And that's actually where the term mentor comes from. Mentor was somebody who was in the community, lived in the community where Odysseus, where his son grew up, right? And so he was somebody who spoke to his son, who guided his son along his way. And when you think about that, these are people in community, folks who you may know for years, folks who you may just be meeting and building a relationship with, but it's about genuinely being engaged and concerned about your well-being and your path. And I think that for me, in so many ways, I've had great mentors along the way. And it always just kind of sparks in me a passion to continue to support folks. I was actually just on the phone yesterday with kind of a young public health professional talking about her career path and what she wanted to do next. And she was really grateful for it. So I think that's part of the lifeblood of this work, is to continue to lift as you climb.
I love it. No, that's exciting. And you are both, again, a physician and as well as an attorney. And so how have those two disciplines helped shape the way that you lead and how you operate?
They're very different, different skill sets, different backgrounds. As a physician, always very much so, people focused and using kind of technical knowledge and expertise, and finding ways to translate that to a lay person so that they can achieve their goals. And I think that's a lot of what my work as a physician is. And I think you get to be up close and personal, intimate with the community in a way that's that's unique as a physician. Conversely, my skill set in the law, it really taught me how to be analytical, how to be thoughtful, and how to convey a point. How to create that roadmap as you're building an argument for any level of advocacy that you're doing. And so I saw those as two really complementary skill sets. There's a quote that a lawyer is either a parasite or a social engineer, right? And that idea of using the law as a mechanism to help engineer our society, and then using that lens as a physician whose goal is to help keep our society healthy. It felt like a really good marriage for me.
Wow. But a commitment nonetheless. You still took the time to take both of those study paths, and then of course carry through to do them in your career. And so you've also served under now two history making leaders. So the first Black president, as well as Virginia's now first woman governor. What have those experiences taught you about the relationship between representation and real impact?
Yeah, it's funny. I have a friend who's actually the governor in Maryland, Wes Moore, and he always talks about being the first Black governor in Maryland. And he said, I'm not here to make history. I'm here to make poverty history. I'm here to make, challenges in our communities history. I think that's the mentality of both of the leaders who I've worked for, President Obama and now Governor Spanberger. I think both of them aren't focused on themselves. And I think that is that's one of the remarkable realities, is that these are folks who are bringing new and fresh perspectives to their respective spaces, and they're bringing in other folks to work with them to do the same thing. And so I think they're really inspiring us and encouraging us to make sure that all of Virginia, in this instance, feels seen, heard, viewed, and valued. And I think that what's interesting is it's 2026 and we're still having firsts, right? And I think that's the part that's not lost on me. It just tells me that there are still so many segments of our communities that haven't had the opportunity to be those leaders, to have that agency to drive change. And so when we have these moments, lean in and see what good we can do together.
Truly. And so you've also studied in other places outside of just the state of Virginia. Like your path has taken you outside of just the Commonwealth, but Virginia is still where you choose to build your family and work and also lead. What continues to root you here in Virginia?
My mama. No, my folks are from Spotsylvania County, and I think there's nothing like being able to just drive an hour up the road and pop into home. My kids being able to grow up near their grandparents, both my parents and my wife's from Appomattox, so we're rooted among family. And I think that's what community really is, right? It's this combination of familial relations, of folks who you've had decades of history and experience with. I was out with my wife for our anniversary and ran into one of my high school basketball teammates, right? And I hadn't seen this guy in 20 plus years. That's what it means to be in community, and that's special. I don't take that for granted. And so Virginia's home for me, and not just for me. I'm one of 6 kids. My siblings are scattered all around this great Commonwealth. And so, so many of the towns and communities I go to, I've got a personal relationship with. And it really grounds the work that I do as state health commissioner, because I'm not just seeing a place on a map. I'm seeing people, I'm seeing experiences. And I think that helps me be really, really thoughtful in my approach.
I love that, and we'll make sure we clip up the mama answer and get that sent to her after this. Um, Virginia's current state of wellness is kind of where I want to take this conversation now. You've said, and I quote, "Health is shaped not only in hospitals and clinics, but also the places where people are born, grow, live, learn, eat, play, and pray." Through that lens, how do you assess the current state of wellness in Virginia?
I think that there are pockets in Virginia where people have wonderful resources and opportunities to get and stay healthy. It's kind of that notion that Virginia can be a place where you can get the best care in the world. And at the same time, there are pockets in Virginia where folks are distanced from health opportunity. They're, surrounded by factors, both in their homes and in their communities, that drive illness and that create challenges for them from a health perspective, from an economic perspective, from a social perspective. And I think that's a reality here as well. So I think Virginia is a tale, like many states, of inequity, of the fact that we have various health experiences. It's never anybody's expectation that everybody has the same health experience. That'd be That's an absurd kind of notion. It's that idea that no matter who you are, no matter where you are, whatever your health experience, you've got the resources and tools and access to allow you to get and stay healthy. And we haven't achieved that here in Virginia quite yet. So there's certainly unique threats in our rural communities to folks having access to the care they need, and that's driving some of the inequity. Certainly ongoing historic dynamics in some of our communities with regard to access to wealth and resources, food insecurity, housing instability, that list that you just referenced. Some communities are mired in that more than others. So I think that for us, that's what the work of our generation of public health leaders looks like. It's how do we lean into those factors that drive, that truly create health, and try to make that health really an opportunity for everybody.
For everyone, yes. And for people who hear the word wellness and maybe think only about their personal choices or even medical care, what do you want them to understand about the broader conditions that are shaping health in Virginia right now? And you kind of touched a couple, but maybe there are some additional.
Yeah, I love the frame of wellness because even when we talk about healthcare and we talk about a healthcare system, so often we're talking about sick care. And I think shifting people's brains, shifting their gaze, and talking about what it means to be well. I also recognize that wellness for a lot of people evokes notions of both physical wellness and mental wellness, right? And I think we start to bridge some of those gaps and those divides between physical and mental health, which I think is critical because they're so intimately related. And so, wellness not just being an aspirational thing, but being something that folks should be striving for and that we should be helping people achieve. I think that has to be our focus. It allows us to talk about obesity and nutrition and so many factors in community. And so I think it's important. And I think that as we move forward as a society, that framing is going to allow us to really break through that next glass ceiling where we have so many folks who are struggling with health challenges. Starting early, because this happens across the life, we're starting early with the focus on wellness. I think that'll make a huge difference.
Absolutely. And to your point, again, it's cross generational. It's not just one pocket or one demographic. Uh, and as you assess Virginia's health landscape, where do you see the biggest disconnect between the health outcomes that we want and the conditions that people are actually living in right now?
Yeah, I mean, I think that to me, it's really two things. The first is trust, and I think that one of the biggest gaps in our communities is that um, there have been these really historically challenged, strained relationships between individuals and healthcare systems. Historically, we had segregated wards across Virginia, and that legacy still lives on in some of the communities where I engage. And so that really phrased that trust in a unique way. Where you can think more recently to the COVID pandemic and how that frayed some of the trust with some of our communities with even public health, right? And so I think trust becomes one of those really key dynamics. And then the other part of it really is this idea of equity, and that's just making sure that people feel seen and valued. And I think that it's hard for people to feel seen if they don't hear mention of themselves, their conditions, their circumstances in the way that you talk about health. If your frame is always kind of a go talk to your primary care doctor about getting vaccinated or cancer screenings. And we know that, some large percentage of folks don't have the usual source of care, don't have a primary care doctor, right? Or primary care doctors have left their community or they don't have healthcare coverage, then suddenly it's hard for them to feel like you're talking to them about their health. So I think that so much of it has to be the way that we center people and the broad range of people and the way that we talk about approaches to health. So I think those are two of the things that come to mind. They kind of stand in the way.
I love that. And we'll go over to that trust piece a little bit further. So VDH's strategic plan talks about being a trusted source of public health information and services. What does earning that trust look like in practice under your leadership?
I think earning trust in the context of VDH isn't too dissimilar from the idea of earning trust in communities in general. It means you show up long before there's a problem. You show up long before there's an ask. It means that you show up and you stand beside people or behind people, but not in front of them telling them what to do. And I think that that's kind of the posture that we're taking. In so many ways, I'm following the lead of our health districts. We have 35 local health districts who do an amazing job of building these relationships and building that trust. And it's not dissimilar from when If you look at a lot of the data, it'll say people trust their own doctor, but they don't trust the American healthcare system, right? And that proximity is the trust that people feel. And I think the same is true in public health. People will trust their local public health department, their local health district, but they don't necessarily trust public health across Virginia. And I think that we want to build that trust by showing up, by being in spaces across community, by not just sitting in Richmond. And that's not to say that that's what prior administrations have done, but it's just to say that that's what our stated goal is to really be out in community, showing up and asking people what they need and doing our best to serve that.
And BDH has made also workforce strength a core strategic priority. And so how much does staffing shape what public health can actually deliver?
Staffing is critical, and not just the numbers of people, but also, when we have vacancies in public health, people just take on more work. And what that does is it kind of wears out the existing staff. It's exhausting. And this is hard work, but it's heart work. And so people are so committed to it, they're not going to say, no, it's 5 o'clock, I'm out of here, right? And I think that the workforce piece for us is it's making sure we're bringing more people into the fold and diverse people into this space so that we as an agency look like the communities we serve, but also it means that we create career paths for folks so that they can grow in public health. It's that we are an attractive field for young people in public health. And so I think we have a lot of work to do to support our staff. And that's our staff really across the Commonwealth. There's over 3,000 folks who work with the Virginia Department of Health. And I think that's a large portion of state employees. And so we want to make sure we show up for them so they can show up for their communities. It's just like on an airplane, they say, you got to put your own mask on before you can help somebody else. We got to do that with public.
Yeah. And switching gears here a bit, you recently told clinicians that Virginia should continue following the American Academy of Pediatrics immunization schedule. Why was that important for you to do?
Well, we touched on trust a little bit earlier, and I think that, for us leaning into science and evidence and saying, what's the weight of the evidence with regard to vaccinations? And how can we reflect to the community that that's what we're going to follow? The AAP, with their vaccine recommendations, their guidelines, it wasn't just AAP, it was dozens of organizations who all looked at the data, looked at the evidence, looked at the science, and came to the same conclusion. And I think we're in a moment where people are hearing and seeing a lot of things in the news about how decisions are being made in federal spaces. And we wanted to make sure at the start of this administration, we were showing how we were going to make decisions. That it was going to be rooted in kind of where the field is, where the evidence is, and then really clearly communicate that with the public. And so that was important. And I think it's been helpful in kind of reorienting people to our approach to public health.
Absolutely. And so for those who may not know, what is Virginia's plan for well-being for the 2025 through 2029 time period?
Yeah, well, the plan for well-being, it's a long time coming, right? This is born from a partnership for Healthy Virginia. There were dozens of community organizations and stakeholders that came together to think through what should our priorities be across the Commonwealth. So in some ways, this is a strategic document for us. It's our state health improvement plan. So, we've done the research to say where are the challenges. This is our way of saying, what are we going to intervene upon? And I think that was critical. So tackling issues like maternal mortality, tackling issues like obesity, tackling issues in mental health and substance abuse, and even some of the social determinants like housing, for instance. Those are all things that didn't come from somebody sitting in an office in Richmond. Those came from community, and it was our way of saying these are the consistent themes we heard across the Commonwealth. So this is where we're going to rally a lot of agencies, a lot of organizations, and point our collective gaze toward improving the health of Virginia. So that's why it's the plan for well-being. It came from the community, and it's the plan we came up with together to ensure the well-being of the Commonwealth.
And for anyone who's curious listening, so the focus is on our 6 major issues, and as you mentioned, infant mortality, firearm-related deaths, obesity, mental health, overdose and substance abuse, and social determinants like housing and transportation. And so when we think maybe just short term, even like this summer, and I'm sure all of these you're making tremendous efforts with, but what's maybe one that you're like, hey, we have the greatest opportunity here to make some meaningful progress here in the short term?
Yeah, I think in terms of making progress in the short term, the key is really bringing together those stakeholders, having a really clear implementation plan for each of those, and so around things, each of these goals, we tracked toward Healthy People 2030 goals. So it's not like we're just making it up on the fly. We said what's achievable, what are our peer states aiming for, what's our nation aiming for, and we want to hold Virginia at least to that standard. And so I think what's great is that all of our partners, they're able to think through what their role in implementation looks like. All of our local health districts, they're able to think about how they operationalize that on the ground. It matches with their community health assessments and community health improvement plans. So implementation wise, just like all politics is local, all public health is local. This is going to play out at a very local level in our communities. So our goal is to make sure we're giving resources, tools, and supports to those localities to really move the needle on those six items.
You mentioned partnership a couple times today, and so we have a lot of health professionals and health organizations who are going to listen to this. What makes for a good partner in this space?
Yeah, I mean, a good partner knows when to step up and speak up, and when to step back and listen. And I think that in any given room, your role might look and feel a little bit different. A good partner knows what their kind of current cachet or standing with the community is, so they know when they should be the one leading and driving, and they know when they should be a quiet collaborator. A good partner shows up consistently. They are up to date with kind of what we're doing, not just we in this experience, but just more broadly, like what the group is doing. I think a lot about collective impact and approaching this from a collective impact mindset. So a good partner knows they're not always going to be the loudest voice in the room, but their voice is in the room because they represent a really important part of the work. And so I think that's a lot of what it requires. It's accountability, it's deliverables, it's knowing where you need to do your part, but also knowing when you need to help push the group forward. So those are some of the keys to me. It takes so many different forms, but I think we have some amazing partners across the Commonwealth. So that's why I'm really excited for this work.
Wonderful. And VDH's strategic plan talks about. So we already again spoke about the trust aspect, but the strategic plan also emphasizes health opportunity, community partnerships, and health in all policy approaches. How do you translate language like that into something local communities can actually feel and benefit from?
Yeah, health opportunity, is one. I think in some ways it's operationalizing the idea of health equity. So it's taking that concept of health equity and helping folks understand this is about you having the opportunity to get and stay healthy, and understanding what you're navigating in community. So I think that verbiage, that language, certainly helps. Similarly, I love the health in all policies frame. That's a reminder to us, right? Every policy has impact and ramifications, and understanding that you understand that when something changes in economic spaces and housing spaces and food access spaces, it's going to reverberate in the health and well-being of our communities. And so taking that lens allows us to not just view health policy as the things that explicitly name clinics and hospitals, but also the things that name those key drivers of health and community. And I think that's important. So, these kind of terms, this framing, I think it's important for us because it helps people understand why we show up in the spaces that we do. We get accused a lot in public health and in healthcare of mission creep. It's like, stay in your lane, your work is health. And I think that what people realize is people don't live their lives at the clinic. They live their lives out in community, and that's what drives and shapes their health. And so for us to get upstream of illness, we've got to be engaging in all the spaces that really dictate and drive health. And I think that's more resonant today than it was 10, 15 years ago. And so I think this is a key moment for us to turn that corner and make sure that people see that real impact and see that our emphasis is on addressing it.
Yeah, in our communities, of course, across the Commonwealth are very diverse, or even just for our Spanish speaking population, being able to have resources that they're able to connect to. And so listening also is such an important part of your role as being a good listener. How does what you hear from people across Virginia influence the priorities you set for the department?
Yeah, I mean, I think when you make it your posture to listen, you know, and this is a lot of what I took from clinical practice, right? You walk in rooms and you ask people where it hurts, and you can't just go in and say, "Here's my plan. Here's what I'm gonna do." When you ask people where it hurts and they tell you, you're not providing good care or good service unless you specifically engage what they're telling you. And I think that for us, some of that is systematizing how we listen, how we pull together what we hear and what we learn. Across our health districts, that's our community health assessment effort, and our 35 local health districts do that work. They periodically will do these health assessments to listen to their communities, and it's a really thoughtful process. And then we pull those together and we say, what have we heard, and how does that inform our priorities? And in understanding priorities shift and change, and also priorities for some don't necessarily rise to the level of priorities for every single Virginian. If you look regionally and geographically, we have different priorities across the Commonwealth. So it's about showing up in each community to meet their specific needs and not seeing it as a monolith.
Awesome. And just a couple more questions here. As you look at what you have been able to do just so far and what lies ahead, what are you most excited to build or accomplish with the department during your time as commissioner? You, of course, as well as your team and your staff.
Um, Most excited to accomplish, I would say first and foremost, it's really showing up and honoring our staff, the folks who do this work every single day. If you think about the way public health has been demoralized over the last few years, I think that our ability to affect change across the Commonwealth is predicated on our ability to feel like we're in a good place as an agency. So I think we have an opportunity. I say it all the time. I was like, I want this to be the best place to work in all of Virginia government, and I think that we do that by really honoring the work of our leaders on the ground. So that's one thing. But I think even beyond that, I just want to make sure that Virginians know who we are and that we're here really passionately to support them, to serve them. And that's going to go a long way in building some of that trust. It's just, I want them to see our work and know. People have said for years, public health is working when you don't hear it or you don't see it. And I think we got to change that notion a little bit. We need people to know public health is working and here's what it's doing for you. And so that's one of the things I want to help move forward.
Awesome. And for anyone listening who may just want to be able to keep up to date with all the work that you all are doing, or follow the progress, what would you recommend them to either do or follow?
Yeah, I mean, I think your local health district is a great way for you to see kind of what's happening, and certainly on social media, whether it's Facebook, whether it's Instagram, the strong presence just in showing that community work. Of course, vdh.virginia.gov, we keep our information updated, and I'm out and about all across the Commonwealth as well, and I'm on Instagram at VDH_commissioner. I think there are so many ways that folks get a chance to see our work. And more than that, we don't want folks to have to look hard and look far to find VDH. We're in their community, we're doing work. So we want to just make sure that we're visible, so we're easy to find.
Awesome. Well, Dr. Webb, thank you so much for taking the time here with this. This was a very powerful conversation, and I appreciate your service. And we look forward to seeing the continued progress that you're going to have throughout the department and your tenure. So we appreciate you.
Well, thanks so much for having me. Enjoyed the conversation, and y'all be blessed.